Good Monday morning, everyone. Thank you for watching Atlanta and Company. Hey, have you ever thought about getting involved in a clinical trial? By doing so, you can play an active role in your own health care, gain access to new treatments, and helping others by contributing to medical research. And joining us today to tell us how we can get involved is Dr. Arnold Weil and Director of Clinical Research from the Georgia Institute of Clinical Research, Ruth-Robinson. That's a mouthful. How are you both?
Great, thank you.
Oh, good to see you.
Well.
Welcome back to you, Doctor,
Thank you.
and welcome to you, Lee. Well, let's talk about what is clinical research.
Well, clinical research is basically where someone can come in and be part of a study where they can get some medications or get a different type of treatment that may not be available to them and help us determine whether certain drugs may be advantageous or helpful for a particular disorder.
And are there any clinical trials going on right now that you wanted to make our viewers aware of?
Absolutely. We have many clinical trials, one of them being for patients with fibromyalgia.
And what exactly is fibromyalgia? I hear it all the time, but not quite sure what the symptoms are and how your body's affected by it.
Well, patients with a diagnosis of fibromyalgia typically fall into a category where they have particular pain in different parts of the body, along with other types of complaints. This study actually looks for patients that have widespread pain, patients who are older than age 18, both men and women, that just have complaints of pain all over their body. So we will actually determine if they have fibromyalgia or not.
Okay, so the best candidates right there on the screen, male or female, at least 18. And you've had pain or tenderness for at least 3 months. And that's anywhere? Like not in a particular spot, in your back, in your leg?
Yes, just widespread pain and tenderness throughout your body, at least for 3 months. And again, it's not necessary that they have a diagnosis of fibromyalgia, because those are the symptoms, and we're really honing in on those symptoms, and we can determine if they do have it or not.
If they do or they don't.
Right.
Excellent. And how about compensation? Is there any kind of compensation for being in the study?
Well, what's nice is, sometimes patients are not able to get medical care. So if they qualify for this study, or we have many other studies with back pain or knee pain or chronic pain, they actually can get the medical care during the study, but they also get paid for participating in the study for their time and travel as well.
Wonderful.
It's a win-win.
Yeah, absolutely. And how about, do we need insurance to qualify for the trial? No?
No insurance is needed.
Great.
Patients can just come if they qualify. Again, they can participate and they'll be compensated as well.
Okay, so for the fibromyalgia and actually for any of the other trials, where do they go in particular? What location?
Well, our office in Marietta, non-surgical orthopedics, that's where we perform the clinical trials. We are in Marietta, and they can just contact Lee at her office extension, or they can find us through our website as well.
Good. And what can we expect? So if somebody does fit all the criteria, what's the first step when they come into the office for the trial? How does it go?
Lee?
We'll review their medical history with them, any current medications that the person may be taking, and a physician will evaluate. There may be specific questions that we may go over to see if they do qualify for the study, if it would be a good fit for them.
And basically, we'll just determine whether they really qualify for the study. And if they don't, they may qualify for another study we have as well.
Okay, good.
Yeah.
And let's talk about, I've always heard with clinical trials that somebody is actually taking the medication and somebody's taking a placebo. Is that how it works?
Well, in this particular trial with fibromyalgia, like about half the patients will be taking the actual study drug. About a quarter of them will take another drug that's already been approved by the FDA for fibromyalgia.
Got it.
And the remaining 25% get a placebo. So there is a chance that you get a placebo. But sometimes in certain studies, if you're on the placebo arm, at some point you're able to convert over to the regular drug at some point in the study.
Got it.
But you still get paid.
No kidding.
Whether you are on the real drug or the placebo drug.
Right. And how does somebody get involved? What do we need to do? Go to the website or phone number to learn more?
You could call us. You can visit our website, and there'll be links to either contact us via email, and our phone number is also on the website as well. If you're in the area, you could just walk right into our office, and we may ask a few questions and see if you pre-qualify for a study right then and there.
So it's really easy to get involved and to inquire about the different trials that we have going on.
As you said, it's a win-win. So terrific. Thank you, Doctor. Great to see you again. Lee, thanks for this great info.
Thank you.
Appreciate it. Once again, if you are interested in a clinical trial for fibromyalgia, please give them a call right now, 770-421-2038, or visit the website at nsoresearch.com. And this segment was paid for by the Georgia Institute for Clinical Research.